Good afternoon. My name is Zakia Salim, and my project is on barcoding medication administration, BCMA. BCMA came about when stakeholders for healthcare suggested different ways for the healthcare system to become more tech savvy and to protect the patients by creating different technologies for safety measures. This safety measure is to assist with nurses giving out medication. The safety measure identifies and helps help the nurse identify the 5 rights of medication: right patient, right time, right medication, right route, and right dose. This curriculum is for new nurses when they are entering a new hospital on their orientation. The orientation will include several components of using the BCMA technology. The curriculum will start with a short informational video about what BCMA is and the importance of it. It will then move on to allowing for each nurse to log into the hospital's electronic medical record, choose a dummy patient, and given a barcoding scan. The barcoding scanner will look like this, and these numbers are specific to each patient. When the nurse scans the barcode with this scanner, the patient's electronic medication record will appear. The nurse will then scan all of the medications that's due for that time frame. As you can see in several of these pictures, you see that each medication also has barcodes, and once it's scanned, it will go into the EMR, the electronic medication record. And if it's the correct medication, a green check mark appears. If it's the wrong medication, an X will appear. If it's not the correct dose, it will give you a warning and you will choose the correct dose. The nurse will then check off all of the medications. If the medication is not scanned and the nurse tries to give the medication by just clicking onto the medication, a warning sign will come. It will give the nurse options to why she is not barcoding the medication. At the end of the month, each nurse will have a tally, and if too much medication that weren't scanned, she will be spoken to by the education team. The purpose of this is for safety for the patient, so not scanning medication is not acceptable. At the end of the instructions, the nurse will go through 5 different scenarios and have a score at the end of each scenario. The goal is to have a 90% or above to pass the curriculum. In the short video, I will show you exactly how this is done. So here you see that when we're administering medications, we have a safety check, and this is what we call our barcoding, and the nurse will scan the patient's ID, then the patient's medication will come up on our screen, and then we will scan the medication that's due for the patient. If that medication is not due at that time, it will give us an error code. So as you can see, the objectives for this program is to make sure that the nurse understands the meaning of the BCMA and to perform the steps successfully.